Hey guys, welcome back to episode number 4. Just running through the adverse events of special interest, which are the recent release of side effects that Pfizer BioNTech has been court ordered to release to public forum, as opposed to their plan of releasing these in 2085. So there's over 1,200. Let's get started. We're going to take right off where we left last at video number 3, moving on to side effect number 53 at ankylosing spondylitis, which is an inflammatory disease that over time can lead to the spine fusing. Anosmia, fancy name for the loss of smell. Next up is acetylcholine receptor antibody positive, which is an indication of autoimmune response. And a presence of these autoantibodies is typically found in those with diseases such as lupus, rheumatoid arthritis, Graves' disease, and other immunosuppressant diseases. Anti-actin antibody positive, major component of smooth muscle antibodies, typically detected in patients with chronic active hepatitis and celiac disease. Anti-aquaporin 4 antibody positive. We're getting into a lot of the antibody positive negative section of this first page of 9 pages released. So, the anti-aquaporin 4 antibody positive is a highly specific serum marker of neuromyelitis optica, and that can facilitate the differential diagnosis of NMO and classic multiple sclerosis. Moving on to anti-basal ganglia antibody positive, typically associated with post-rheumatic fever, chorea, and tick bites. Anticyclic citrullinated peptide antibody positive, which likely means you have rheumatoid arthritis. Anti-epithelial antibody positive is an indication of immunobolus disease, which results in widespread blistering of the skin. That sounds painful. Anti-erythrocyte antibody positive. Antibodies found from a blood test that target your red blood cells and is harmful to you if you are pregnant and to your unborn child. Anti-exosome complex antibody positive. My dog just got this chunk of fur hanging from her mouth, which is like I could not see that. Where the heck was I? Okay, anti-erythrocyte antibody positive. So I said that one. Anti-exosome complex antibody positive. Basically found in those positive for autoimmune disease, cancers, and neurological disorders. Moving on to anti-GAD antibody negative, and then there's an anti-GAD antibody positive, but it's like the same definition essentially, so we'll just put them together. So a positive is an indicator of type 1 diabetes, but a negative result doesn't necessarily mean that you don't have type 1 diabetes. Anti-ganglioside antibody positive, so associated with GBS, which is a rare autoimmune disease in which a person's own immune system damages nerves that cause muscle weakness and can lead to paralysis. We got 5 left here for today. Anti-gliadin antibody positive, which is found in individuals with celiac disease. Then there's anti-glomerular basement membrane antibody positive, which damages the basement membrane and can lead to kidney damage. Anti-glomerular basement membrane disease is a rare disorder that can involve quickly worsening kidney disease and lung disease. Anti-glycal tRNA synthetase antibody increase, consistent with the diagnosis of polymyositis, and suggests an increased risk of pulmonary involvement with fibrosis in such patients. Last and certainly not least today is the anti-insulin antibody positive. Now, this is an allergic response to insulin. It doesn't indicate whether or not they're seeing this in patients with type 1 or type 2 diabetes, so I will just assume that they're probably seeing it with either or, since it wasn't specified either way. So that's it for today. We'll move on to episode number 5. in a few days and move on to our next set of side effects. Ciao for now.